Hello everyone, I am Dr. Sonali and today we are going to talk about a very small topic which is also an introduction to immunology, that is innate and adaptive immunity. Okay, let's start. Now in the vast battlefield of human body, millions of enemies lurk like your bacteria, viruses, fungi and parasites, all of them waiting for an opportunity to break in. But something waits for them at the gates, an immune system older than time itself. Now, this immunity doesn't need to be trained, it doesn't ask questions, it was born ready. I am talking about innate immunity, your body's first responder. Now, let's see the definition. Innate immunity is something which you are born with, your body's inborn resistance against infection. Okay, so when innate immunity kicks in, it's fast. We have no doubt about that. So let's see the properties. It is the first line of defense. It acts in minutes. It's quite fast. It's always present. It's present since birth. Okay, it's species specific, and apart from being species specific, it's also individual and race specific. That means it varies from species to race to individual. Now, it targets very non-specific. That is, the cells of innate immunity like your neutrophil, your macrophages and your natural killer cells, they aren't picky. Now, they attack anything foreign and they use something known as patterns. They don't use the ID of the bacteria. That means the immunity doesn't target the bacteria according to their name. That's not specific immunity. It targets according to a pattern, which makes them non-specific. Okay? It doesn't have memory. Innate immunity has no memory. A second infection is handled exactly like the first. There is no learning curve and no long-term protection. Also, the diversity is limited. Your innate immunity targets a limited set of microbial patterns. This is the pattern which I was talking about, like your lipopolysaccharides or flagellin. So, it doesn't customize its response according to the ID of the bacteria or virus. Okay. So, for example, your gram positive or gram negative or virus or parasites, for everything your innate immunity will have the same response. Okay, why? Because of this microbial pattern. So what does it make it? It make the response broad, but it's not precise. It lacks precision. Okay, now this was your innate immunity. Now after your innate immunity, your organism has entered. In the beginning, your body was not prepared. There was a lot of chaos. All the cells just rushed in. Okay, but as the time passed, something changed. Your body slowly started learning. It started adapting and it started remembering, which led to your acquired immunity. Body's adaptive military. Okay, now acquired immunity. Acquired or adaptive immunity is the resistance an individual develops during their life. Okay, it doesn't come pre-installed. It's not ready on day one, but once activated, it's precise. That means that innate immunity lacked precision, but your acquired immunity has precision. It's powerful and it never forgets. Okay. So these are the key points of your acquired immunity. Now, whenever your acquired immunity kicks in, your infection has a very slim chance of survival. Now, let's see the properties of your acquired immunity. It's specific. It targets one antigen very precisely. Okay, that means it is using the ID, the identification, not the pattern, which is because it's targeting only one antigen precisely. It has a learned behavior, which is acquired after exposure. It is inducible. It takes time, days to activate. It has a memory, stronger and faster secondary response. Also, it is more diverse, can recognize millions of antigens through their ID. It doesn't have a pattern which is limited. Okay. Now, let's see the types of acquired immunity. Now, acquired immunity can be classified on how you receive it. If your body is developing it yourself, if you are actively working to your body is actively working to develop it, it is active immunity. And how do a body develop actively? Through infection or vaccination, or it is given to you passively. How it can be given? From mother to child or through ready-made antibody injections. Okay, this was all. And before we end, let's see the difference between innate immunity and acquired immunity. First, the onset. For innate, it's immediate. For acquired, it's delayed. It takes days. Specificity. Innate is non-specific. Acquired is highly specific. Diversity of antigen for innate is limited, but for acquired is vast, is millions. Memory absent in innate, but acquired it present. It improves over time. Dependence on exposure, it's not needed because every time it is the same response. But for acquired, it needs prior exposure to improve over time. Present at birth, the name innate itself is present inborn. Acquired, no. It develops after microbial contact. Okay. So that's it. I'm also working on the whole topic of immunology. I'm making lectures on it and I'll be dividing it into module. I'll be releasing it within a month. So do subscribe to my channel to learn microbiology in a more interesting and unforgettable way, the way it deserves to be told. Thank you.